Introduction. Obesity is a chronic, complex disease causing excess body fat. Obesity is a major cause of death, as well as several health conditions including chronic heart disease, diabetes, and high blood pressure. Causes and risk factors. Besides genetic and hormonal influences, obesity occurs from excessive intake of calories, more than what is required for the body. Your body converts calories into energy for the body to use, and the excess calories are converted into fatty substances, triggering obesity. The most common causes of obesity include sedentary and physically inactive lifestyle, unhealthy diet and eating habits, pregnancy, lack of proper sleep, disease conditions such as hypothyroidism and depression, medications such as steroids, antidepressants, anti-seizure and diabetic medications. Risk factors for obesity include advancing age, being female, and a family history of obesity. Signs and symptoms. Obesity is characterized by symptoms of increased hunger and decreased fullness. Signs of obesity include a high body mass index, BMI, equal to or over 30, and increased waist circumference. This may result in complications such as feeling tightness or discomfort and needing large-sized clothes, inability to use public transportation due to the size of the seats, difficulty with day-to-day tasks, especially those that require movement, feeling tired and short of breath frequently, having low self-esteem. Complications. Obesity is one of the leading causes of preventable death and impaired quality of life. It is an important underlying cause for a number of serious and chronic disease conditions such as heart problems, diabetes, high blood pressure, cancer. You may also have problems related to breathing, for example, sleep apnea, joints, for example, arthritis, gastrointestinal tract, gallstones, psychology, for example, depression, fertility and pregnancy. Diagnosis. Your physician diagnoses obesity based on a complete physical examination, including your weight, waist circumference, medical history, and blood tests. Your doctor will also assess the amount of fat content in your body by calculating your body mass index, BMI. Body mass index is a calculation of weight to height that is commonly used to classify excess weight and obesity in adults. Treatment. The goal of treating obesity is to facilitate weight loss and help you achieve a healthy weight. Treatment is centered on balancing the intake of energy in the form of food and the expenditure of this energy in the form of activity. Obesity treatment options include lifestyle modifications, weight loss medications, and weight loss surgery. Lifestyle modifications that help to reduce body weight include dietary changes, physical activity, and behavioral changes. Dietary changes include eating healthy foods rich in nutrients while avoiding high-calorie, highly processed junk foods. Being physically active helps you lose weight and maintain your weight. Behavioral changes include adopting healthier habits to reduce your eating triggers, such as watching TV, listening to music, or chatting with friends while eating, avoiding stress, and participating in a weight loss program. Weight loss medications. Your doctor may consider a weight loss drug in combination with lifestyle modification if you meet one of the following. Your body mass index, BMI, is greater than 30. Your BMI is greater than 27 and you have a complication of obesity, such as diabetes or high blood pressure. The approved weight loss drugs are bupropion naltrexone, Contrave, liraglutide, Saxenda, orlistat, Xenical, phentermine topiramate, Qsymia. Weight loss surgery, also known as bariatric surgery, is considered in patients with obesity. Weight loss surgery leads to decreased hunger and increased fullness. The available surgical options for weight loss include gastric bypass surgery, also called Roux-en-Y gastric bypass, involves creating a small pouch on top of your stomach and bypassing the flow of food directly to the small intestine, thereby avoiding absorption from the remaining part of the stomach. Laparoscopic adjustable gastric banding, LAGB, or lap band surgery, involves separating your stomach into a small upper pouch and a larger lower pouch using an adjustable band. The food intake is restricted or limited by adjusting the band. This procedure is minimally invasive and offers slow and steady weight loss. Sleeve gastrectomy, also called tube gastrectomy, involves reducing the size of the stomach by stapling or by removing a large part of the stomach to reduce the absorption of food. After this procedure, your stomach appears like a tube rather than a pouch. Biliopancreatic diversion, BPD, with duodenal switch, is a complex surgical procedure which involves removing a large portion of the stomach and bypassing the food flow away from the upper portion of the small intestine. This procedure offers significant weight loss, but can be associated with several complications. Summary: obesity is a chronic disease characterized by excess body fat. Obesity treatment is necessary to prevent severe health problems and to lead a longer and healthier life.